Good morning, everybody. So, you have a good time at Devs on Stage? I know I did. I love it. We're actually going to get a little preview of stuff that we saw in Dev on Stage in this session. Pretty cool. So my name is Jonathan Drummey. I'm a data visualization specialist at Path. I'm also one of the 33 Tableau Zen Masters. And thank you. Wow. So I had the great fortune several years ago, thanks to the Tableau Foundation, to get involved with the Visualize No Malaria project. And I went to Zambia back in 2017, and it started this conversation between me and Jeff Bernson here about the possibility of working at Path full time. So I just feel incredibly lucky and thankful that the Tableau Foundation and all of you who are customers of Tableau, whose license fees and everything help support the foundation, through those grants help pay for my job, but also let me use this amazing software to help work on malaria and HIV, improve maternal and child care around the world. So thank you, Tableau, and thank you, everybody here. And now I'll hand it over to Jeff.
Hi there. I'm not Jonathan Drummey. I'm Jeff Bernson. I'm the Chief Data Officer for Path. And you'll hear a little bit about us in a minute. It's just a pleasure to be back here at the Tableau conference. Many of you heard about Visualize No Malaria, and today we're going to do a little bit more discussion about how Path as an organization is using Tableau as well as a full stack of technologies to just do more with data. So with no further ado, we will jump into things. I just wanted to talk a little bit about Path. Path is a global health organization. We think of ourselves as global health innovators, working to really solve some of the world's toughest public health challenges in low resource settings. And we primarily focus on improving inequities in health and thereby the lives of women and children around the world. We work in 70 countries around the world, and we have about 250 projects at Path that look a little bit like Visualize No Malaria that you heard about, and you're going to see some more that we're working on around the world as well. So a little bit deeper into Path, we work across 5 platforms. We work on improving vaccines, diagnostics, drugs, devices, and also strengthening health systems. And I hope that actually we have visualizations that touch on most of these, what we would call platforms or core areas for the organization today. So we're going to talk again about our data journey. I'm going to turn it back to Jonathan. I'm going to apologize ahead of time. Jonathan and I are going to be going back and forth, and I bet that at one point we're going to turn to each other at a slide and say, no, it's you. No, it's you. So bear with us as we do that.
All right. So everybody has really well organized data and perfect data and everything. So yeah. So we're going to talk a little bit about our awesome data, which in the case of Zambia starts out with community health workers like this, who are volunteers who are out there in the field collecting data on logbooks, on paper, giant stacks of books, a lot of data there, entering it into cell phones, and collecting it. In other cases, we have people who are well advanced, that's a cellular connected tablet collecting vaccination information in Tanzania. So to that, and then we have tools like Tableau that let us visualize data in different ways. So we're using dashboards and working groups, working with those dashboards in different ways to help things. This was an early draft of the viz you saw the other day in the keynote. And then we get into bigger data, like here's terrain data at a very tiny level of detail in Ethiopia, and there's about 15 years worth of precipitation data at a 5-kilometer grid level across Zambia. So very small hand-collected data all the way up to many gigabytes of satellite data is kind of the scope of what we do.
So one of the things when Jonathan and I started working together, even before we convinced him to join Path, was we started to see a common trend. That when we started to work with our teams at Path and also in our counterparts, Oftentimes, we start in this very sort of hopeful, idealistic state. I'm sure many of you, this might resonate, where we actually have a set of questions, and we think that those questions are going to perfectly align, and of course, we're going to have data that's all connected, and it's going to be accessible to us. And then, of course, what's going to happen is it's going to turn itself into answering those questions and into amazing analytics that's going to not only impress our supervisors, but also save lives and just change health systems around the world. Unfortunately, in our world, though, that's ideal state. Is this forwarding? And that's how we want to be. What we've found, let's see if I do it like this. Here we go.
Yep.
All right. Step back and point while not looking. So, in essence, what we really have is we end up having lots of questions, and they end up to be really disparate questions, and oftentimes maybe tangentially connected. And it's really hard when we start working with health systems to figure out what is the order that these questions should be answered in. And then as we start digging into the data, even though we might be told that, yes, there's data, we found out maybe there's not data, there's not as much data, it's definitely not linked data, and that's when it starts to hit us that also there are other issues too, like problems with connectivity, as well as maybe quality of the information, maybe the time it takes to get this data. And then we start to realize, we might not have all of the resources we need, especially people who can do visual analytics, maybe do some of the data science that we need, and also create some of the amazing data products that eventually get used. And this is a great silhouette of either Jonathan or I in some of the work that we've done, because we end up with a stack of work and oftentimes not really clear how we're going to navigate through that. Here we go. So as we think about this process from moving from questions basically to a point where we have data, I know that for me, as a trained epidemiologist and trained in public health, I was trained that there's this sort of linear process that you go through in terms of data. That there's definition and planning, and then of course there's data collection, data cleaning, and data preparation, analysis, and data sharing and archiving, et cetera. The problem is that what they don't really talk about is how much time this takes, right? And the fact that in the real world, we got tons of people waiting for us to get these questions out. And so the other piece is that we don't really talk about some of the challenges for this analysis. The fact is that we think that we're going to start out with a plan when we start to dig into our data. And I would say that actually is a challenge in almost nearly every project that I've started with. The analysis plan that I started with, if we had one, right, was not the same analysis plan that we ended up with. We also know that at least in global health and also in development, we often don't have the staff and the skills that we need to execute on that plan. And oftentimes that plan, as we start to dig into it, we see that we're missing certain data elements that we didn't count on, and that there are changes along the way in those requirements. And so this begins to get a bit frustrating, especially for that group of people down below who's, again, waiting for our data to show up, waiting for the analysis, waiting for the actionable information. And again, this sort of makes the sad, frustrated person oftentimes at their desk. Again, you would have found me like this before I met Jonathan Drummey most days of the week. The other part is that this, as we know, is not a linear process. I love that we, at least in global health, we've laid it out that way. But in fact, we consistently are in these loops where we're going back and revisiting the data. We're either cleaning it and preparing it multiple times, we're analyzing it. And so we're in this, it's more of an ecological model as we think about moving through our data and our information. And so we thought, as we looked at some of these sort of traditional models and we started working with the teams, what if we started to look at this not through the eyes of data, but actually through the eyes of people, and kind of how the human brain works, and all that frustration, and dare I say, some of the unsafety, the insecurity that you feel as you start to tackle data and data sets. And we started to think, okay, what if we put people at the center of this? What kind of model, what principles would help drive this? How could we start to chunk down this process so that our simple human brains could start to actually move through this linear process more effectively and potentially more efficiently? And that's where we started to create this 4E model that we're going to really talk about through the rest of the day today. So the first piece to our 4 E's are where I think we like to start is with expose. And oftentimes that's the first step with the organizations and counterparts, where we just start to peel back the layer of what is the data. Oftentimes when we start to work with global health organizations, they haven't actually touched their data. And they haven't spent time really thinking about the granularity of that information. And so we really try to spend a lot of time thinking about that. What are the data sources? Again, what's the granularity? Then we move to a principle and a set of approaches around actually exploring the data, putting it into a format where we're just objectively looking at the data together, and putting it into different pivots so that we can drill up and down in the data, and we'll show some examples of that. And then finally, once we've done those things, we're starting to be ready to ask questions, ask why, and start to be able to explain the data. And that, I have to make sure we get these really fancy pieces here, but the point is that as we get into that, we can start to ask questions, why, what's going on, and start to point out where we see potential similarities or changes in patterns, potential outliers. And then making sure as we go through these first 3 E's, we have to choose tools and approaches that actually make it easy, empower people as we go along this process. I mean, that's one of the reasons why we're here. I think we're all here at this conference, is that Tableau is one of those catalytic tools. It's one of those tools that as you use it, it starts to build potential capacity. And you don't only see insights, but you actually build up your skills and competencies in touching and using data. And thinking about that and putting people at the center of moving through these 4 phases really helps us actually break down the problem from that linear process, which for me anyway, and data is part of my daily life, is overwhelming. Okay. Oops, I'm already into your slides.
Yeah, sure. All right, so one of the things with this model is we can sort of think of it as phases, but really they come around and touch each other, and we're going to talk about that. So we're going to spend the next chunk of the presentation going through each of these pieces and talk about how they impact our work and how we use them. So the first one we're going to do is expose. I'm just going to move this over a little bit to try to make it a little easier. So peeling back the layers of that onion. And one of the first places for us is cleansing data. So for me, when I get a new data set, it's often like first tracks and fresh powder in skiing. It's totally awesome, except when the data is more like a swamp, which it very often is. So having tools like Tableau Prep available to us is great. So here's a little Tableau Prep demo of a real world situation. We're starting out with some malaria data, and we need to join in some population data. And the population data is a messy Excel spreadsheet. And we need to use the data interpreter to clean that up. And then we're going to clean up some fields in here. And being able to do this with users who are primarily Excel users and not data people, and having tools like this is fantastic, that it's all drag and drop for them to pivot, change field names, change data types is really great. We'll do a couple more here on this of just whipping through these, and this was real time running through Tableau Prep with this, and now we're doing a join. We're going to do the join on the district level for this, which is kind of like county in the United States. facility level, and we get a bunch of bad facilities here, and being able to cleanse these values so quickly in Tableau Prep and have people see things side by side instead of having to look at two separate data sources and try to figure it out is just a game changer for the user population that I work with. So, so that's one piece of Expose, is just having tools that let you see those problems in the data and work with them. And then another place for us, instead of trying to go through some sort of analytics pipeline that we don't actually show people data late, we want to get them in their hands early. So this is a dashboard that Anya Ahern built as a volunteer on the Visualize No Malaria project. And what we're looking at here are healthcare facilities and community health workers. And we have cases that boundary that we're seeing there of the kind of brown is the boundary of the district, and we actually have a healthcare facility that appears to be located outside of the district that it's supposed to be in based on the references in the data. So being able to flag this and show this then led to the district health information officer going around to the health facilities with his cell phone and Google Maps and taking in the latitude and longitude, and then it kicked off this whole email thread for us to cleanse the data. So by exposing this really on, we're empowering hundreds of people to be involved in cleansing the data, and it's not just up to poor me. So that's another aspect of Expose. And then the other piece of Expose that Tableau is so wonderful at is with server and online, is we can really push out that data to other people. But there's cases where organizations don't want to get into a whole mix of a ton of different systems. So, so in a lot of our work, we're using open source electronic health record system called DHIS2 that's used in about 60 different countries. And this is DHIS2's interface for looking at and pulling your data to look at. So you can basically download giant pivot tables, which can take forever or be too slow that they crash the system. So with that, they want to start using Tableau and they don't want to have to leave DHIS2. So one of the things we've been working on with help from volunteers from Star Schema,
there you go.
And this is, okay, it is going. All right. So this is the DHIS2 interface. We got a lovely little Tableau logo on there. People can click on this, and then they're looking into Tableau projects and things, and then I'm just going to use this right now, and then drilling down, and then they're able to see Tableau vises inside it. So being able to expose the data to people where they live and where they work is this other part of this principle of Expose. And now we're going to talk about Explore. So Tableau Desktop, or now with Tableau Online, giving us this interface with all of our dimensions and measures and this amazing blank canvas that we can just play on and work with. This is the delightful part of working with Tableau for me. And how many of you have that too? Just dragging and dropping, and you see stuff and it's magic. So that's kind of the ultimate definition of Explore. And then we have some other ways that shows up as well.
So the example I'm going to talk about today, so I had the opportunity to be based in Kenya, in Nairobi, these last 3 years. And so one of the things that Path does is we have worked with the Ministry of Health to create sets of data products and dashboards. And one of the things that we were asked to do was really help develop their approach to making data available around reproductive, maternal, newborn, child health. They actually have a scorecard that they use across the whole country where every county, every quarter can see how they're doing. Their indicators are at the top, and their particular county is given this scorecard, and their sub-counties are down the left-hand side. And so these are basically paper-based. They're produced in Excel, and they're printed out for meetings every quarter. People come together, they look at them. And one of the questions they had is, okay, so this is great, but this is static, and we really aren't getting people to do much with this data. In fact, the conversation becomes more about why is the data wrong? Why is my area red, really green when it shows red? And so what we started to think about is, okay, how do we start to put this into a format that they're used to looking at, but then be able to actually drill down several layers? And so, of course, what we did was we developed a scorecard through Tableau where all the counties actually now could see each other. You could select your county, see your scorecard, start to see not just red, yellow, green, but also the blue starts to highlight maybe where we have some data challenges, like things like 1,080% increases and things. And then allow people to drill down on that scorecard and not just see a particular cross-section, but also see the trend line for every particular indicator. Right? So this is like the classic Explore scorecard. We're using all of their thresholds. We haven't changed the thing. We haven't actually brought new insights into this. But what we've done is
we haven't gotten rid of the red, green, yellow color palette.
Right. But what we've done is we've expanded the view by adding in all of that granularity, either the longitudinal view and then also the ability to kind of drill down past that sub-county level, right, into what you saw was a ward level, and then also further on down to a facility level. And that's what you're seeing here on the right-hand side. These are the wards in a particular county for a particular time period and a particular indicator. And now what you'll see is on a particular indicator, you can start to drill down on I shouldn't even say high performer or low performer, a green or a yellow ward, and then start to see where that performance is being driven from in terms of different facilities.
All right. And that dashboard, like it's a really simple dashboard. We're just replicating a chunk of paper in Tableau. And that can be a huge win for people just in migrating to having it be interactive, be available at any time, and scale as well. So when we get back, it's gone up from like 1 county to 2 counties to 3 counties. There's 47 counties in Kenya, and this time next month we'll be in all of them with that. So that's just from providing that, and then we'll be working with the staff to evolve their skills, which we'll talk about more in a bit. So now we're going to talk about working with all the data. We've got a project called the BID Initiative, which is in a few different countries. These are women in Tanzania, and this is about childhood immunization. So we work with all of the immunization data from Tanzania. And we had this question. It also includes stock information about how many vaccines are there, expiration dates, things like that, what their inventory is. And so we want to know how many facilities had vaccination stockouts of how many days. So those of you who've worked with this kind of question in Tableau know we got to do some work on the data preparation side. Well, in Tanzania, they've got 5.7 gigs worth of data, and they were using Excel and Power Query as much as they could, and those ran out of steam. So we had to start using tools that could handle all of the data that we wanted to work with. And in our case, we're lucky enough to have Alteryx to work with that. So there's part of the workflow that processes that data and lets us run through it, and then we're able, once we build that, building the Tableau viz was just a couple of pills, and we'll zoom in onto a chunk of it. Of this down here, and so we have days on the x-axis going from 50 to 550 days, and then how many stockouts they had of how many days, and way out there on the right is 518 days. So a facility was, some facility was out of a vaccine for rotavirus for almost 1.5 years. So that's some of the challenges that we're working with to help get the stock to the facilities so children can get the vaccines when they need them. Another place in terms of Explore is connecting people to the data. So Marina Brinkhurst from Mapbox was recently in Zambia, and she traveled around and saw this is a map that somebody's really using of their district. And on that, it's actually a heat map, drawn by hand and really useful to them for helping things out. So with mapping, there's this whole way on this map, there's other details on the map, like where the hospital is and other things on there. And we've got a video of Marina talking with one of the people we're training in Zambia about the importance of maps.
What are some of the changes that you would make to a map like this that would make it more useful?
A district is a community, and within that community there is history. So what we would want to see as part of a customization for these kinds of maps is that first of all we want to have our churches there represented in the map, and then we also want to have our schools represented in the map.
So where these are public health officials and they want to connect with the communities to help eliminate this deadly disease of malaria. And for that, when they're showing maps, they want to have all of those local landmarks on the map. So one of the things in the last training that we did was we were training the public health information officers on how to use OpenStreetMap. So they were entering data into OpenStreetMap about their areas and entering these landmarks, and then going back and training their staff in how to do it as well. And that just not only benefits the health work that we're doing, but everybody else in the world, including all of us who use Tableau, since Tableau uses OpenStreetMap and Mapbox. So that's pretty cool getting at that grain of data. And then in looking at the data, we want to get down and see, have tools that let us see that finest grain of data. So not just live in the old world of cubes and things like that, where things were pre-aggregated and we couldn't see it. We want to work with it at that finest grain. And to tell you about that, I'm going to have this guy talk about it.
Some countries have been at the forefront of this next generation of surveillance. Zambia, with help from donors, is invested in the core of these surveillance systems. They've trained health workers to report back on the cases. They've trained them to get the medicines out and do community-level treatment. And it's invested in getting the new...
All right, enough of him. So that was Bill Gates presenting at the Commonwealth Heads of Government meeting back in April, where the Bill and Melinda Gates Foundation committed $1 billion to malaria elimination. Other Commonwealth countries and institutions committed another $3.5 billion with the goal of eliminating malaria reducing malaria across about 60 countries by 50% in the next 7 years. So massive commitment. They used a viz, he used a viz I built. So really cool. Yep. And the thing we're looking at in this viz is we're drilling down into the map. We're changing the spatial areas we're using, and at this level we're looking at individual homes in Zambia, and they're colored by whether or not they've had indoor residual spraying for malaria. So we're able to track whether houses have been sprayed at this incredibly fine grain of detail and look at that and then use that data in later processing. And the fun thing was the set action stuff you saw in the keynote was based on the work I did for this. And so all of us will be able to do this kind of amazing drill down in Viz's, and it changes. I'm super excited about it because it changes how we can interact with the data. When you can click on a mark and expand the mark and click on it again, it's incredibly fun. So when Bill Gates got this viz, he spent about 10 minutes just going through it again and again and again. And his speechwriter had to say, hey, Bill, we gotta actually do work. So it's not just me. So being able to have that capability is huge. So having talked about explore some, now we're going to talk about explain, which is really about understanding why these things are. This is my former colleague Noah's son, so thank you for the picture, Noah. And so when we're explaining data, trying to explain and understand what's going on, we can look at the numbers and everything, but sometimes the numbers aren't enough. So in this example, here the video's starting to play. So we're working with some data in Mazabuka district in Zambia. So we're looking at community health workers here, and we're dragging out how many active number positives, so how many people were tested for malaria, and seeing a descending bar chart, so pretty good distribution of the data there. And then we're going to drag out the active number positive, and there's one that looks pretty high there on that, and then we'll drag out another one that's the active number of traveled malaria, and start doing some sort on that, and see there's this one community health worker that has a massive amount of positive malaria, which is really strange in malaria work. Usually where it's such a fine grain of data here that the numbers should be close together, and to have a big jump is like that. So our first reaction is like, okay, somebody screwed up entering the data, something's wrong. But then we talked to Fortune Blenje, who's a malaria officer in the district, and he explained to us that that community health worker is actually based at a sugarcane plantation. And so we popped a little satellite map up in Tableau, and lo and behold, there's that sugarcane plantation with all the green circles and everything there. And then we look at the data, and there's this spike every year in April. And Fortune was able to tell us the reason why this spike is there is that April is sugarcane harvesting season, and there's a bunch of migrant workers coming from another province where there's a much higher incidence of malaria, and they're bringing malaria with them there. So this is data. We just have this data point here, and my point with this is that when we're doing explain, we not only need to look at the big data, but also the very small data that is apocryphal data that lives in people's heads, and find ways to get that out there so we can understand what that source of variation is. So in this case here, they're actually communicating back to the villages and towns where those those workers are coming from, and having them get tested and treated for malaria before they go to work in Mazabuka district.
So another great example of explain is through another project we're involved in called the BID initiative. BID stands for Better Immunization Data. This is a project that is actually in 2 countries, Tanzania and Zambia. And it looks at childhood immunizations. I don't know how many people know this, but childhood immunizations is like one of the most effective interventions that we can actually employ in public health. It saves millions of children's lives around the world. And so getting immunizations out to kids is, it's a huge priority for nearly every public health system around the globe. And it's also particularly tough in low resource settings. And we collect a fair bit of data around the supply chain, just because in low resource settings, vaccines do cost money, and we want to make sure that as many of them get out to the kids who need them the most. And before this project, we would collect lots of data around the different actions associated with the supply chain in terms of delivery. We might even collect reasons for why certain vaccines were discarded. That's what the rows show, and over time. But not presented in a way that people can actually interrogate this actually makes it really hard to explain what's going on with particular vaccines. Here, we're presenting the data by vaccine. And so we start to think about different ways to present that information. Of course, simple bar chart is fine here. We can start to see where we're seeing the most amount of discarded vaccines, and then also the months where we see those potential spikes. That's great. But one of the things that this project started to do is also start to overlay the reasons for those discards. And you saw that in the earlier slide in terms of the rows of that data. And it started to lay out, okay, so what's actually going on? There's actually a lot of reasons why you might see wastage in vaccine vials and quantities. There's a lot of good reasons for it. However, there are some systemic reasons. I'm sure there are people in this room who work in supply chain that point to signals where we can potentially improve the system. And so what you're seeing, for me, my eye is attracted to the blue part of the chart, which is showing that, in some cases up to a half, maybe a third of our quantities are being discarded because they're showing up broken. And that's actually something that we can solve for because we can start to think about how these vaccines were packaged, potentially how they were transported, and also how were they handled once they arrived or on the way to arrival to those facilities. So this kind of insight, again, allows people to start to explain what's happening and then start to target the different problems and start to think about different solutions.
So AI and machine learning is really big. There's lots of vendors here that we're checking out as well on this. So here's just one in thinking about explain using statistics for what statistics is good for and understanding sources of variation and outlier detection and variability in your data. So in this case, this was done by one of our interns using the R StatScan tool, which is doing clustering based on time and space to identify clusters of malaria out in southern and western province in Zambia. So that's a whole other way we can think about explaining and working with the data. And that's an area where we're certainly trying to do more with and more automated as we can. So that's explain. Let's talk about empower some. So one of the things with empower is about having these tools that can really catalyze learning and and help decision making in our organization. So it's about empowering users to do that. And when we think about that, okay, what are the tools good for? What are people good for? So we want to look at what are humans good at and how can we grow skills on their side, and then figure out what are computers good at and what are things we can offload from the humans that are working too hard onto those. So certainly with growing skills, there's training. So this is a slide from a training. Anya Ahern went to Zambia a couple years ago and did a training with some of the staff there. So building that up, building centers of excellence, and there's a bunch of sessions here at the conference on that, to work on that. There's also helping people understand what is possible because we come into Tableau used to certain tools. So all these visualizations you're seeing here come from Makeover Monday back in April, where we supplied a data set, a sanitized data set from Zambia. So one simple data set, and there's over 50 gorgeous visualizations coming out of this. And we're actually using this in training to show people this is your data, and these are all sorts of different ways you can use that. So helping people to get out of the Excel mind or the SAP Business Objects mind or Cognos or whatever tools they've been using into what they can do in Tableau.
So the next example we have, which I think is near and dear to my heart, is thinking about just how do we actually visualize maps and mapping. I'm showing a bit of our code. I hope it's our code, frankly. I don't even know. But sort of what it takes, a snippet of code to kind of start developing your map in R. And who have I insulted? How many coders are out in the audience there? Okay, good. So I've insulted a fair number of people, but really this is not meant as an insult. I'm actually in awe of all of you who code. I cannot code. I think it's a genetic deficiency, I'm fairly certain. But that shouldn't stop me from using data, right? That shouldn't be the thing that inhibits me from actually getting very tactile with it. And so what's so wonderful, again, about some of the tools that we're deploying, whether it's Alteryx or Tableau, is that when it's time to draw a map now, it's really just three clicks, where you're actually pulling out the different locations that you need, and voila, you've got your map. And this is the kind of thing that when we take it to a low resource setting like Zambia, and we put it in the hands of many people who really their coding skills are on par to mine. Sometimes they're better, I would say. But really, it's not been an area of focus. They all of a sudden are free to really start exploring the different maps and areas that are in their location. This is Lawrence, one of the people that Jonathan has been training over the last 9 months, and part of our first cohort of trainees and basically power users that we're creating in Zambia as a part of the Visualize No Malaria project. And that really kind of, just to put an accent on this point, is that's ultimately what we're trying to do, not just with people like me, but also our beneficiaries and also our counterparts in the places that we work, is moving from these data consumers to power users. And this is really a shout out to Jonathan and Anya and others who have come to kind of do this training and empowerment work with these tools that are easy to use. These are just some of the visualizations that have been produced over the last 9 months by a group of 10 people who will now take forward these skills and also this competency in Zambia and start to be our next generation of trainers for malaria elimination.
Wow. So this is the other thing when we think about empowering users, is what we can do when we give time back to them. So in a lot of cases when we're working with Excel, reports can take day or days or more to do. And if anything takes 8 hours to do, for me at least, that's going to be spread over like a week because I've got other meetings and things like that. So that's one scale that we work on. If we can take that time and cut that down to an hour, an hour or so, that's about an order of magnitude improvement or more in how long things take for somebody. And that's a huge amount of time. I can block off an hour in my schedule. Suddenly a lot more becomes possible. If we can cut that down to about the time it takes to make a cup of coffee, about 5 minutes or so, there's another order of magnitude improvement in what is possible and feasible for people to do. And then when we can cut it down to the time it takes to take a sip of coffee, drag and drop one pill, boom, we have an answer. Then that's a few seconds, that's another order of magnitude improvement. So when we add all those up for people, we're talking about 1,000 times improvement in what they can do and the impact that they can have on the organizations that they're with. So we really think about empowerment as not just giving people tools, but what those tools enable them to do. And with that, we got to iterate. We can't just be in that linear mode of building something and delivering it. We need to play with it. And I've got a really great example from the Visualize No Malaria project. So when we started out on the project, so as volunteers, we're a bunch of Tableau Zen masters. We love hacking and doing stuff with Tableau, and we're pulling in satellite maps that nobody had seen before and everything. And in this case, we're trying to visualize changes in malaria incidence over time. So we're across the map, we're playing with different things on that and being super fancy about it. And then Anya goes out to Zambia and she's sitting with the users who would be actually using these maps, and they're like, this is great, but we got these community health workers out there in the field and some of them don't get in their data on time. And so we've got these spreadsheets full of how much data they've submitted and everything, but we want to look at it better. So a few minutes later, just dragging and dropping and doing some exploratory visits and everything, and you get some stuff saying like, okay, who's best, who's worst, how are things over time, all of that. That's great. And then they're like, well, what we'd really like to be able to do is let people know when they're missing, when they haven't submitted data, and get them some reminders and everything on that. Because one of the challenges there, going out into low resource settings, is sharing the data. So this is how, in some cases, data gets shared in Zambia, is people sitting out in an open air meeting and stuff is displayed on paper. And these happen like once a quarter or once every 6 months. So that's a really long feedback loop, and we wanted to close that loop. So that in this iteration, what it ended up leading to was looking at, okay, we're gathering data from cell phones, it's going into a big data source of things, and we're building lovely Tableau visualizations on it, and how can we close that last loop? So this was a little piece of the project I worked on, which was the Visualerts tool, which is an add-on to Tableau, open source add-on to Tableau. You can download it from GitHub, and it does a bunch of stuff that subscriptions and alerting in Tableau can't do. So in our case, it's doing text messaging out to facilities and community health workers. So we're basically delivering a Tableau viz within 140 characters. 2 people, and using that to increase response rates and improve our data collection so we can have better data to actually eliminate malaria. And with this, so there's the piece of this around just taking time to iterate and find out what people really want, and we end up with a solution that's way more satisfying for them and works better. And as part of that, one of the things that we've seen over time is this kind of U-shaped curve, where at the bottom we have our x-axis, we have the expose, explore, and explain kind of phases of a given set of work, and then on the upper side we have the complexity of the visualization. So when we start out working with the data, we're building relatively simple visualizations to try to understand what's going on with the data, expose it. And then as we get kind of that picture of what's going on with the data, we're able to build more and more complicated dashboards with more interactivity, more views and everything. But then as we understand, like, what are the sources of variation in data, who's late, who's not, things like that, then we can get into really specific fine-grained actions coming out of the data, and our visualizations get simpler and even turn into things like work lists or text messages to people. So who are the patients I need to see today in a healthcare environment? What reports do I need to get in? So we found this model really, really useful in as a learning framework for working with data, and I'm going to leave this last bit to Jeff.
Yeah, I think he's leaving it to me because it probably had the most impact on me. Because really, I work every day with people who are not used to working with data at the granularity that even the data is supplied. And I think that what we found was, when we started to put this model or approach together with some of the aspects that Jonathan talked about, being iterative, being incremental, adaptive in this approach, everything that probably people in this room really feel like it's a part of their job. And then think about those activities, which frankly speaking, these are scary activities to many people: data cleaning, analysis, even the sharing of that information. And we start to apply this approach and really start to think about chunking down those activities within each of the aspects of this lens. It allows us to present this whole process in a much safer way, so that people can actually recognize that they too are on a journey. And the purpose is really not just to complete the journey and it's going to be done, but it really that they're just they have access now to the tools to continually improve how they're going to actually shape and then eventually use their data. So with that, I think we've left a little bit of time for questions. I don't know that we have a microphone floating around, but we're happy to repeat the question. I'll just point you to both contact information for Jonathan and myself. And then we did write a little blog article about this approach, which we would invite you to hit up our traffic and yeah, maybe it'll spur some questions. So let's go ahead and.
Yep. I saw somebody. Was there somebody over there?
We have someone in the front here. Sorry? The logo for Path? That's our new brand. Yeah. So the symbols actually represent a lot of the work that we do around the world. Yeah.
Yeah. Okay. So the question was about on the drill down map. There were some houses that it said it didn't apply. In there, yeah, I don't think you have to go all the way back to it. So one of the things is with the satellite data that we're using in that mapping, there may be structures that are identified as houses, but they're not actually houses. It's the shop, it's a barn, it's things like that. So it's not actually a place where somebody is spending the night that would need the indoor residual spraying. Gentleman in white over there. Yep. Okay, so the question was about data collection. So in international development, data collection is a big challenge in places. So in our case, we have DHIS2 is the repository for the data. Some people have internet access and they're collecting the data from DHIS2. Some people are using a mobile phone app, which was developed several years ago for feature phones. And we actually have a challenge because feature phones are getting really hard to find at a decent price. And so we, like in the next year, we have to figure out a new data collection platform for our mobile users.
Yeah, and I'm happy to talk to you more about that offline too. Just there are a plethora of solutions to collect data. Some are really, really good, really nimble. Others I wouldn't trust or get involved with. So happy to talk to you afterwards.
When you move from that static red, green, and yellow dashboard to that interactive,
I can swap over to it.
Thanks.
put that interactivity into the hands of your users?
So the question is when we move from the scorecard, that red, green, yellow scorecard that was static, that Excel sheet, to basically this the Tableau dashboard that allowed us to drill into it. What we did was we put it on a Tableau server and then allowed our users basically to gain access to it. It turns out that Kenya actually has Tableau server, so it turns out that it was actually a really easy transition. The other example that Jonathan talked about in Expose is the next step for us is to embed the whole thing right back into the source data, DHIS2, which is where their data lives. And that, so that when they go into one system, it's one-stop shopping. They don't even know they'll be in Tableau working on that dashboard.
You can get interactivity in DHI2?
DHIS2, yeah. Yep. Good question. Yeah, go ahead.
So I really love that chart where you sort of showed the complexity of the viz, sort of cresting and falling. Do you have any advice on how to get people to sort of fall in love with those complex vizzes? To really orient and center on the user? Having a good idea and talk to this.
Yeah. So I just want to say that I'm a recovering complex viz addict, okay, and I really highly recommend getting in touch with a Zen for that. They have pills and medication, but in all honesty, I think a lot of it is getting some of that experience with people who can actually. One of my first visualizations, I think, was with you. Is I poured every single color that you could potentially use with spark lines into a chart and then mapped it. Right, and there was probably 10 things going on. And so really having that external perspective of an expert, and we have this wonderful community of people who will tell you like it, tell you how it is, I think is really useful. And also if you can get them to tell your boss how it is, it's even better. So I don't know if you have anything.
Yeah, I'll add a couple things. So one thing, and for me, like a lot of my learning is from Kelly Martin, former Tableau Zen Master, and Anya Ahern. And Anya has a master's in industrial design, so she thinks design thinking and everything. And so I really have learned a ton from them. But there's a piece like Kelly Martin starts out every viz with everything in neutral colors. And then she is incredibly careful about what she adds to it. So the idea is this visualization that we have here, we're taking up somebody's time and attention, and it's really precious. So we want to use that as best we can to help them make decisions and help them do whatever they want to do. So for me, with a lot of visualizations and going from that, I'm thinking about what is this visualization used for? And asking somebody to drill into, what are you going to do with this? And the piece for me about where a visualization ends is it doesn't end with somebody getting some bit of information. It ends with them taking some sort of action in the real world. So I want somebody, when they see my viz, they're going to pick up the phone and call somebody. They're going to get on some machine and twiddle some settings on that machine. They're going to engage set up some meetings to change some business processes, things like that. So we want real world actions out of that. And that can be really hard sometimes because people get afraid. We end up having to be change agents in our organizations because people are afraid of changing the status quo and how things are done. So there's a whole other realm of doing that, which can be, for me, certainly in my career, has been a growth opportunity to think of myself that way and how I help organizations do things better. So that's my spiel on that. Yep.
Thank you so much. So in my sort of career, the best name is something that I almost found myself wishing that I had done a degree in design research.
Yeah.
How do you give me tips on how sort of people from a data perspective can sort of get up the curve and how to
Okay. So the question was around having, like, coming from a data background, having more of a design perspective and learning from that. I'm in your shoes myself. Like my way into Tableau and doing stuff was much more about calculations and the kinds of things it did in the data, and my vises are crap. So one of the things here is it takes study and practice and practice and practice in doing that. And so making time in your day to just build things and try to iterate and get, if you have managers, get their support in doing that as a learning process to do that. And then study the masters, study the people who put out amazing things, take apart their vises, ask yourself, why did they put this element here and not an inch over on it, and use that. So there's people like, I mean, there's a bunch of them sitting in the front row here with Adam McCann and Christy Martini and Anya Hearn and Noah Salvatera, who all do amazing stuff.
I would just
and
add,
then we have an Iron Viz contestant from Europe sitting in the front row over here, and Sarah. So people who do a lot of good stuff, and you can learn from them.
and I would just add that, listen to your users. Oftentimes they want something a lot more simple than what you're wanting to put together. In terms of you often start in a place of, oh, this is the art of the possible. I want to show you all of the functionality, and you saw even some of the visualizations that Anya put together. When Nelson was out there, they put some of these things together. It ended up being one thing. It was a bar chart, just as a starting point. And that led to text messages, right, being sent out in an automated way from our dashboards. Yeah. This is like one of the most vexing problems that we have, right? Because we have these digital tools available to us, and we have to move from this space of just pushing data out, right? And then actually to close that feedback loop, and then ultimately get people to improve upon the data. So one of the things that we did early on was exactly what you saw here, was closing the feedback loop around quality. You're missing your report. Right, you have erroneous information, please correct it, right? And that's allowing people to, in their phone, because we collect data in Zambia through the phones, allows them to go back in and actually update that data. We're also using Viz alerts to push other information out to close the loop with users at both the provincial and district level. And I'll just make another plug, just because I think this is a really sort of a new space and a place that we can be more innovative, especially in global health and global development. We have a project coming up right now which is focused on how can we use data in ways to really nudge people and move people into that next action, that next activity. So it might be digital solutions like figuring out different modalities of text messaging. This is pretty basic right here. What we're doing, it's kind of it's a reminder or an alert. But what if we started using recognition or celebration, or we started using comparisons, right? What if we took a note out of the playbook of Lyft or Uber or any one of these groups that motivate their drivers, right? Could we do the same thing in global health? So we have a project that's going to start up in the fall that's actually going to look just at that piece. Yeah.
And I'll add one part to that. I've come to think there's 4 languages that we're learning when we're learning Tableau. So one, going to the point over there is like, okay, how do we make gorgeous visualizations that communicate well is one of them. How do we work with data in a lot of cases where we have users of Tableau who haven't necessarily spent their lives writing SQL code? So how do we do that? Then there's, I'm just blanking out on one of them, but the one in this case is the language, like how do we do business process change? And how do we work with that in organizations and set up structures that can, at the speed at which Tableau can render and visualize data, start using that to affect change in the organization. And so for me, some of the most, when I was in Zambia multiple times this year, some of the most valuable time in the classes was actually these people just getting together and talking about, now that we know this, what do we do? How do we work with this? And they're in a case where they're in a changing, it's not just the data's telling them more, they're in a changing environment because they're actually eliminating malaria. So what you do when your incidence rate is at 1,000 per 1,000 population, so effectively everybody gets malaria once a year. When you're getting it down to 100 and 10 and down to 1 and 2, you actually have to change what you do. And they're having to figure that out on the fly in ways that work for them. So that's a whole way in organizations have to shift to deal with that.
I think we have time for one more
Yeah,
question.
maybe one more. There's somebody over there? Yes. The tech stack? Oh, I wish we had one tech stack. Okay. So Path being project-based, it's historically at Path where there's a project, there's a set of grants, a lot of our taxpayer dollars in the United States help support Path. So each grant has specifics about what it does. And then the team has their skill sets and they're working with partners in ministries of health and things like that around the world. So historically at Path, the projects have tended to be fairly siloed. So there's people using Excel, there's people using R, there's people using Python, Power Query, a little Power BI, it's a whole mix. So one of the things that came in was Visualize No Malaria, and the grant from the Tableau Foundation, thank you, Neil, is introducing this tool to Path that lets us do a lot more. So now we're up to about 200 Tableau desktop users across Path. We're a 1,600 person organization right now. And so there's people using it in projects as well as businesses, and we're still trying to figure out, honestly, how do we get that out to people, because we're a nonprofit and we really like to use the money really well. So people are very heads down in delivering the services and not necessarily sort of looking up to see what's possible and how could their lives be made easier. So that's part of the challenge for Jeff and I in our work, is to evangelize that and grow that in the organization. So I don't have great answers on that, but it is a constant work, and there's certainly other people who've helped done amazing work out here in other sessions. Yep. And for the technology stack, we've been really, as one of the first Tableau Foundation partners, it led us to some early partnerships as well. So through Alteryx and Exasol and Twilio, Mapbox, Digital Globe. Am I missing anybody? And then folks from Starscheme and Interworks also helping out as well. And of course, Datablick, which I used to work for before Jeff hired me. Yeah. So with that, entering into those partnerships to help us out with that. And if you are working for a nonprofit, there are tons of people out there who want to do good with data, and reach out, get involved in your local Tableau user groups, get involved on Twitter and social media, Tableau Public, things like that. If you ever, and I'm just gonna put this out there because I love supporting the community, it's given me so much. If you do something and you want somebody to socialize it out, tweet me or send me a message, email or whatever, and I will do that, just to get that out there and promote your work. So
You'll do that for me?
I would do that for you.
Wow.
Yeah.
That's great.
Even you.
Yeah. So with that, I think we'll probably close the session. A big shout out again to the Tableau Foundation, Neil Myrick, for helping us get this work off the ground.